Did you know that the doctor who makes the final diagnosis for most cancers often never meets the patient? Histopathologists are the specialists working behind the scenes, examining tissues under the microscope and making diagnoses that can completely change a patient's treatment. But there are also a lot of myths about this career. Is histopathology really a lifestyle friendly specialty? And is it becoming more competitive to get into? And with the rise of AI, will pathologists even exist in 20 years? Hi everyone, I'm Saba, a histopathology trainee in the UK, and in this video I'm going to walk you through what histopathology actually is, what the day-to-day work looks like, and how you can get into the specialty in the UK. So today I will be talking about histopathology as a career, what to expect and how to get there. If you're a medical student or a junior doctor thinking about your future specialty, histopathology is definitely one of the most interesting options to consider. So first of all, what exactly is histopathology? Histopathology is the medical specialty focusing on examining the human tissue in order to make a diagnosis of any kind of disease, including cancer or inflammatory conditions or benign neoplasms. In many cases, histopathologists are basically responsible for providing the final diagnosis, especially in cancer cases. And the specimens that we receive in the lab generally fall into one of these three categories. So the first one are big surgical resections. So these are larger tissue samples removed during surgeries, like a bowel resection, a uterus resection, mastectomy, or a lumpectomy. The second are biopsies, which are smaller samples. They can be taken in clinics or in GP practice, and they are taken to investigate a suspected disease, which may later need a resection. And the third are the cytology samples, which are fluid-based specimens. Um, and it could be pleural fluid, CSF fluid, cervical smear samples, or if there's a cyst and they drain a cyst, basically it can be sent as a cytology sample. So all of these samples are processed in the histology lab, and then they will be examined under the microscope to reach a diagnosis by the pathologist. Now, let's go through the role of histopathologists in the NHS. So, histopathologists play a crucial role in the patient care within the NHS. Our main responsibility is analyzing the tissue and cell samples in order to diagnose diseases, including cancer. Histopathologists also conduct autopsies and postmortem examinations in the NHS. Also, we contribute significantly to national screening programs such as cervical screening and breast cancer screening program. Another important aspect of the job is intraoperative consultation, also known as the frozen section reporting. And that's happening where surgeons may request a rapid diagnosis during an operation. In addition, histopathology is also a key member of MDT meetings where the complex cancer cases are discussed together with surgeons, oncologists, radiologists, and other specialties, and they are part of decision-making process for the patient future treatment and care plan. So, what does the daily work of a histopathologist actually involve? So, first of all, one important part is the gross examination, where we basically going through what we receive as a specimen with the naked eye. We describe the features, we cut through the tissue and select the areas that should be processed for microscopic examination. Then it comes to the microscopic analysis, where basically we have the slides, we go through the slides under the microscope to identify the disease pattern and reach a diagnosis. Sometimes we need to do extra works like immunohistochemistries or molecular techniques to reach a diagnosis, and all of these are done and are requested and analyzed by the histopathologist. In cancer cases, also, we have to go through the staging and subtyping of the tumors, which helps guiding the specific treatment plans for our patients. The job also involve participating in MDT meetings, as I said before, going through cytology specimens and reporting those. And also, some people decide to carry on doing autopsies and doing postmortem examinations. Now let's see why you should consider histopathology as an option and a specialty for your future career. I think histopathology is a very rewarding specialty, even though we often work behind the scenes and we don't have that much of the patient contact. But I think our diagnoses have a direct and significant impact on the patient care, because you know that a single pathology report can influence surgical decisions, chemotherapy, radiotherapy, or even the targeted treatments. Even for non-cancer cases like IBD, celiac disease, or Barrett's esophagus, etc., etc., all of these decisions are really, really based on the histopathology findings. And when you make that diagnosis, it's going to be a life-changing diagnosis for the patient. And I think another advantage is the wide range of subspecialty opportunities. So when you go through the first 2.5 year stage of your histopathology training, then you can decide if you want to do any specific subspecialty, such as pediatric and prenatal pathology, forensic pathology, neuropathology, or you can either decide to be a general histopathologist with subspecialty interests like gynecology, GI, dermpath, etc., etc. Each of these subspecialty, they have its own unique workload, case variety. So it's not staying on the same. Um, some people say it kind of becoming boring, but I think you have lots of option to go through whatever you find interesting and just become an expert in that field. Also, talking about the training program, I think one of the most attractive features of histopathology training in the UK is that this is a run-through training program. So when you apply for SC1 and you get a post, it means that you can have that peace in your mind for the next 5 years of your training and know that at the end of this road, you're going to receive a CCT, which means that you will become a consultant. The other aspect, even in the training program, is that the work-life balance. So you don't have any night shifts, you don't have weekend on calls. Most of the time, you're working 9 to 5, so kind of predictable working hours with minimal emergency work, no blips at all. So you can have that peace in your mind. Just go through your work, studying whatever you need to study, and become a consultant at the end of the 5 years. Um, Also, the specialty is very science driven and analytical, which makes it ideal for people who enjoy problem solving, understanding disease mechanisms. If you love to solve a puzzle, this is the best specialty for you. So you have to integrate the disease mechanisms, the clinical presentations, blood test findings, imaging findings, and then histological findings together to make the best diagnosis for your patient. And it's very interesting, I'm telling you. So now I want to go through some several misconceptions about histopathology, and let's go through the most common ones. The first myth is that the histopathologists they earn less than other consultants in other specialties. In reality, the consultant salary is the same as in other specialties, and there are also lots of opportunities for the private work. And as a trainee in histopathology, you will receive a bonus pay, which is something around like extra £400 every month in your bank account just because you chose histopathology as a training program. So I think it's not that much difference. And as I said earlier, the amount of private work available for histopathologists, especially with the use of digital pathology, it means that in the future you have more opportunities to stay at home, just have a screen and report as much as you want and earn lots of money with that. Um, the other common concern is the impact of artificial intelligence. Earlier in the video, I mentioned that about the question whether AI will replace histopathologists. And in reality, I want to tell you that AI is more likely to act as a supporting tool rather than a replacement. So, first of all, still in the UK, we are quite behind for digital pathology, and we don't have digital pathology in all the departments in the NHS yet. That means that if we need AI, we first need to be digitalized everywhere. And then after being digitalized, we need AI to go through lots of like security checks, kind of data protection processes. And then after that, it needs to work for about a couple of years to show that um, we can trust it, basically. And at the end of the day, I think it's going to help us to basically prioritize the work. It can help us to interpret the immunohistochemistry, the molecular findings. It's very helpful, and it's gonna be a game-changing thing in the career, but it's not going to replace the histopathologist. And also remember, we are not kind of definitely sitting behind a desk kind of a specialty. We also still do lots of work in the lab, as I mentioned earlier, about gross examination, doing the cutoff, block selection. All of these needs the human expertise. Um, and also the postmortem examination. Another aspect that still there is lots of need for human rather than a robot or AI. Um, so the other thing, another misconception is that histopathology is an isolated specialty. In fact, pathologists work closely with clinicians, scientists, lab members, MDT discussions, lots of meetings. So actually, there are so much communication and teamwork happening in histopathology, and it's just the patient contact that is quite limited, but lots of other contacts with lovely members in the lab, with the students, with trainees. So you're not going to stay in your office all alone by yourself, because there's too much happening and you need so much communication with other people. So, if you're interested in applying for histopathology training in the UK, I think it's quite a straightforward process. So, the process involves two main steps. The first step is the CV scoring, the personal specification scoring, where your achievements, experience, qualifications are evaluated, and a minimum score is required in order to be shortlisted for the interview. And it's getting more competitive in the recent years. Now, about like 45 points are required for being shortlisted for the interview. The second stage is the national interview, which is usually happening online. It lasts around 30 minutes, and your final ranking for training post is just based on your interview performance, not based on your CV. So the CV is kind of a checkpoint to get through the interview. At the moment, there is no entry exam, so you don't need to do MSRA exam at the moment for applying for histopathology, which I think is a bonus point about this specialty. So here, this is a snapshot of the different categories for scoring for histopathology training, and you can find more details on the HEE website, but just going through it quickly. So if you have any undergrad or postgrad degree, it can help you to have more scores. If you have presentations, posters, there are different scores for if you For instance, if you had histopathology related poster, non-histopath related poster, if it was international conference, national conference, or just a meeting in your department, all of these, they have different scores. Publications, you can get a scores for different sort of publications, including original articles, case reports, letters, etc. If you have had any training in teaching, like a master degree, or just you have done like a 2-3 day course, you can get extra points for that. Also, experience in teaching, have done if you have done any previous teaching for medical students, junior doctors, whatever, you can get points if you can show evidence. Quality improvements, there's always I think a scoring plan for quality improvements and audits. The important thing is that if you want to achieve the highest score for the quality improvement, you need to do 2 cycles in your audit, and it should be presented somewhere, even in your department meeting, and you can achieve the highest score. Next one is the leadership and management based on what you have done so far. If even you help to being a rep, or if you have planning the rota, something like that, it can add to your scores. The point about commitment to histopathology as a specialty, it's basically about the amount of exposure you had to histopathology, and if you do a taster week for 3 days or more, you can achieve the highest score for commitment to histopathology. So I think that's the easiest one to get, and most of the people who apply for histopath, they get the highest for commitment to histopathology. The other one is histopathology related activities. So if you have done any research related to histopath, if you have done any audits, um, or like attended a course, something like that, all of those count. But remember that you can't use the same achievement in this part um, at the same time as using it in another category. So, for example, if you, let's say, if you have done a histopath related audit, either you can use it here or you can use it in the quality improvement. You can use it for both of them. Um, so what I can suggest is that if you have done a histopath related audit, keep it for histopathology related activities, and then do another audit which is not histopath related. Make sure that you do the 2 cycles, make sure that you present it somewhere, and use it in the quality improvement. So as I said in the previous slide, there are several ways to um, make your CV stronger if you're interested in histopathology, and it's better to start early on working on your CV because, as I said, it's getting more competitive, and the minimum score is increasing every year. So make sure that you complete a taster week or placement in histopathology department, do useful activities like research projects, publications, poster, oral presentation, attending conferences. Make sure that you try to um, document if you're doing teaching. Just try to get feedbacks and ask someone basically to give you a proof of your achievements. Go for doing an audit as soon as possible. Make sure that you do the 2 cycles, make sure that you present it somewhere, and try to participate in pathology related activities. What I can suggest is if you follow my Instagram account, all the time I try to reshare whatever courses or study days happening related to histopathology. Some of them are even free for medical students and undergrads. So you can just use these opportunities to make your CV stronger and get more points to have the chance to sit the interview. Now, talking about the interview format, there is another video on my channel going through the interview in details, but talking about it just in a quick recap, so the interview is online. It's about half an hour. It has two stations. The first station is 15 minutes. There is always a question asking you to interpret an image. So every time they ask this question, but basically they change the image. And they show you an image and they ask you to look at it and, for example, explain someone on the phone that what you're looking at. um, the point here is they want to see how accurate you are in finding the details, putting them all together, and how you interpret your findings. This is all they're looking for, because they need someone in the future to look at a slide, a histology slide, interpret the findings beautifully, clearly, and then put them all together and make a conclusion. That's what's happening in your daily work as a histopathologist. This part is about like 5 minutes. They might ask you how do you feel about this image, or what is your overall impression of this image, and that's exactly what you have to do in histopathology um, day-to-day work, like looking at a slide and say if you feel it's benign, it's malignant, it's normal, it's not normal, what you're going to do. um, in this station, there are also questions about histopathology as a career. So they might ask you why you choose histopath, what do you know about this career, what are the challenges in histopathology at the moment, um, different questions about the lab situation, what happened to a piece of tissue from the time that it leaves the theater to the time that the diagnosis is made. Basically, what is the process in the lab? The next session, another 15 minutes, you will be asked questions to see and to evaluate your clinical knowledge. They can give you clinical cases, post-mortem cases, and they ask you some questions about like what investigations you're going to do for this case, and if this is the finding in this case, so what is the plan, what is the treatment, what is the next steps. Also they can ask questions about the pathophysiology of different diseases. um, so you need to have some like basic knowledge for the like have understanding of basic pathophysiology of different conditions. You might also being asked questions about clinical errors, audits, quality improvements. All of this can be asked. But if you want to have more details about interview, you can go through my other video, which is just all in details about the interview. Now I want to be honest with you, and there are also a few important points that you have to consider before choosing histopathology. So first, just know that the specialty involves limited direct patient contact, as most of the work happening in the lab. Um, Apart from doing something like head and neck FNA clinics, like Rose clinics, or some people might do like derm path related clinics. Apart from that, most of the time you don't see patients, and most of the time you spend most of the day in the lab. Um, the other thing about the autopsy training, so the training for doing postmortems is mandatory, and it's happening in the first 2 years of the training. And then when you reach the minimum amount of the number of cases that you need to do, you can choose to opt out after completing the required numbers of cases. So I can understand not everyone enjoys autopsy work, and that's completely fine. Um, and you can choose if you want to carry on doing it or not. So just keep that in your mind, that it's just gonna be for the first 2 years of your training. Um, and when you reach the 40, the number of cases needed to opt out basically is 40. So by the time you reach the 40, you can say, I don't want to carry on doing that, and that's completely fine. No one is going to push you to do that. And also during this time, if someone struggle, there are lots of supports available. Um, there's also a chance to make some adjustments for you. So um, don't be scared, basically, about the autopsies, and know that this is just a transitional thing. It's not forever. Um, and also, just remember that you don't necessarily need to love pathology from the beginning. um, some people think that, oh, but when I was a medical student, I really didn't enjoy pathology during medical school, and that's absolutely fine. That's happened to most of the people, because during the medical school you are just reading the pathology, but you're not understanding what is the impact of the pathology of the disease, and you're not going to put that all together with the other knowledge that you gained through your foundation years. So as a histopathologist, you are not just looking at the books, basically. You're looking at the microscope, you see the cells are talking with you, they're giving you the signs, and then you think how you can put these signs together with the history, with the radiology findings, with serological findings, etc., etc. So it's getting more interesting and kind of problem solving, rather than just trying to memorize weird words or names. So people most of the time ask me why I enjoy histopathology, and I would say personally I really enjoy histopathology training, even because I think even as a junior trainee, I feel like I make a meaningful difference in my patient care. There are also excellent opportunities for teaching, research. There is a balance between independent work and also the teamwork. Um, from the day one, you are working with your consultants, so you're sitting in the same room with them to report the cases together. So you are trained from the first day to become a consultant, rather than being trained for a couple of years to become a registrar, and then after that being trained to become a consultant. From day one, you are trained to become a consultant. Um, the training program is very supportive, too many study days. You are able to take all of your study leaves. If you want to do courses, conferences, they are all open for you. Also, the fact that there are different career options available. I can choose what subspecialty I want to do as a consultant is very interesting in my opinion, and it gives me the opportunity to have some exposure and then decide what I want to do in the future. Um, and I feel like as a trainee, it's quite important that my day to day work is directly related to my education and learning, rather than doing like service provision or admin work all the time and have a very small amount of education and learning at the end of the day. And I really enjoy the thinking process and the problem solving aspect of histopathology, because it makes it very engaging, productive, fulfilling, and at the end of the day, you feel like, oh, I use my brain the whole day, not just using my hands and um, my muscles, basically, to do some I don't know, just physical work. So I think this is so much like brain working, using your brain, and feel like, okay, um, I'm putting everything together, and it feels very rewarding at the end of the day. So let's conclude everything. So to conclude, I would say please don't be afraid of choosing something different. So histopathology may not always be the most visible specialty in medicine, but it plays an absolutely essential role in modern healthcare. And if you are curious about the field, I would strongly encourage you to visit your local pathology department attend MDT meetings and explore the specialty a little bit more. Please give it a chance, because it might surprise you at the end of the day, and you will see, oh, I didn't know that this exists, and this is actually what I want to do. And remember that the real impact on a patient care can sometimes happen in a very quiet office behind a microscope rather than being in a like a busy A&E or a ward. So think about it, keep it in your mind, and give it a chance. Thank you for watching, and you can go through these resources, the RCPAT website, Health Education England, and you can contact me by this channel and also by with my Instagram account. Feel free to reach out if you have any questions about histopathology training or the application. And if you found this video helpful, don't forget to like, subscribe, and let me know in the comments if you're considering histopathology as a career or not. See you in the next video.